Hello, everybody, and welcome back to the Holistic Travel Therapy Podcast. I'm your host, John Wilson, DPT.
And I'm Courtney Condon, occupational therapist. Thank you guys so much for tuning in this week. We have been a little MIA. We've been on vacation, but we are back and we are, rejuvenated. We feel great and we are motivated to bring you guys amazing information and content and knowledge.
Yeah,
So that's why breaks are good, to kind of get everything back on track, take time to relax, decrease your stress, and get excited about doing everything that there is to do.
absolutely. We have a bunch of great new episodes coming your way, but today we're going to be talking about exercise. Now, everybody knows that exercise is good for you, makes you look good, makes you feel good,
Right.
but
Yeah.
there are actually hidden benefits to exercise that a lot of people do not know and they might not understand as they're doing exercise, other than the looking good part. So, today we're going to bring you the four hidden benefits of exercise, and we're really excited.
Yeah, exactly. I think that when we think of exercise, we think mainly of losing weight, fat loss, you know, all of those, like John said, the more like cosmetic benefits. I want to look good. Obviously, a lot of people understand that exercise makes you feel good, but not a lot of people understand maybe why it makes you feel good. And then the long term benefits of completing exercise regularly, things like that we're going to dive into today in detail. So there's four main things that we're going to talk about, and we are going to first start off a little bit with telling you some of like the main beneficial types of exercises that we've looked through the research to find to have the most scientists or research backed information on their benefits. So something like cardiovascular, aerobic exercise, anything that's working your heart, your lungs, you're going for a jog, doing a bike ride, breaking a little bit of a sweat, that is super beneficial, along with strength training. So anything that's going to be, whether you are lifting weights, you are using your own body weight, you are going to work those large muscles, so legs, arms, back. And then we have high intensity interval training, which is gaining a lot of popularity nowadays. It's kind of when you do short bursts of activity, so anywhere from 10 to 60 seconds, followed by a period of recovery time. So that is bringing you a little bit of both that strength benefit and that aerobic benefit. And then another one that people probably don't think about all the time, but it's so huge, especially in our professions when you're thinking about therapy, is going to be balance training, or the fancy term proprioceptive training, where you are maybe standing on one foot, maybe you're working your core in a plank, you're really activating your whole body to understand that it needs to contract to be in a certain position for a certain amount of time. And the benefits for stuff like that go far beyond just that exercise for that day. I mean, we're talking about decreasing fall risk, which is going to be the number one reason why individuals might have a shorter lifespan towards the end of their lives. So, big things with trying to get in a little bit of each type of exercise, throughout the week or even throughout the month. I think we're going to talk about here how, you know, it's so important to get an exercise, but I think the most important thing is the best exercise you can do for yourself is the one you're actually going to stick to and do consistently, and something you enjoy. So that's huge. So since we kind of talked about those, we're going to get into our first one, which is going to be the impact of exercise on your mental health.
Yes, mental health is big. And as a physical therapist, I'm in the outpatient clinic now. I see a lot of people coming in, and one, they either don't exercise and they haven't exercised in a long period of time, and that's why they're having pain and they're having weakness and they're having a lot of issues that go beyond just the physical issues. There's a lot of depression, there's a lot of anxiety. A lot of my patients have these issues, and I can immediately tell on the evaluation just by certain the way they say things and kind of looking at that negative,
Characteristics. Yeah.
yeah, that negative mindset. Um, and exercise is going to do ton for your mental health. So obviously, a lot of people know about endorphins. Endorphins are just chemicals and neurotransmitters released in the brain during exercise. They're feel good hormones. So basically, with exercise, you're already going to get those endorphins to feel good. But even the long term effects of the exercise, the
Right.
blood flow to the brain,
Yes, exactly.
the increase in the cortisol during the exercise is going to kind of get you moving, get you feeling better, feeling productive, stuff like that.
Right. Yes. So one of the studies that I looked at was talking about that when we exercise, we're releasing that cortisol. I think sometimes cortisol gets a bad rep because elevated cortisol long term over long periods of time, yes, can be detrimental for our health. But when we exercise, we are giving those short bursts of cortisol to our body. That is a stress response. But once we get done with our exercise and that dopamine and that serotonin are in our brain and we feel good and we go throughout the rest of our day, our body's like, hey, I had a spike in cortisol and now I'm fine. We've talked about this before on the podcast, these like hormetic stressors, these small stress responses that we're giving to our body to then allow our brain and our body to adapt and say, I can take this on, you know? So next time you kind of get that little bit of stress in your daily life, your body and your brain can react better. Listening to another podcast, shout out to the Model Health Show. It's one that Jon and I really love. Sean Model, he actually said that depression is the number one cause of missed work days. So not injury, not like, sickness as far as cold, but depression, which it's becoming a really big thing, in our society now. And something like this, just doing a little bit of exercise to release those endorphins has not only short-term but long-term benefits on our brain and our overall mental health.
Yeah, and speaking of stress and cortisol and everything like that, like you said, exercise brings on a good stress because there's good stress and there's bad stress. So the bad stress, if you're having a rough day and you kind of let that get to you and you continue to have that increase in cortisol, that's going to be not good. So I would say a big thing is making sure that you're exercising under kind of like a low stress. So maybe, for example, after a long day of work, coming home, doing a little of the breathing that we've talked about before, kind of calming down a little bit, and then maybe like rejuvenating, getting up, kind of warming up, stretching before you do whatever the exercise is. Maybe just a little bit of caffeine at that point, depending on what time of day it is, to kind of get you going again. Because the worst thing you can do, and that's going to kind of bring us into the next part of it, is the gut health part of exercise. The worst thing you can do is have a 10-hour day at work where it's extremely stressful, nonstop cortisol, and then immediately go into a hard exercise. The stress levels are going to be just a little too much, and it's going to really affect a lot of things in your body, mainly the gut. So there are studies where there are people can exercise too much. If they live a stressful life and they think that the exercise is without kind of calming down in that parasympathetic state, they think that that will help. Something like a HIIT exercise or doing something for a little too long period of time. I believe they said anything more than like 60 or 90 minutes of that high intensity exercise is going to be too much, especially on the gut. So, but there's also the flip side of that where, with IBS, exercise is actually going to be a good thing.
Right, exactly. So I think the biggest thing is understanding that your body doesn't know the difference between a good stress and a bad stress. It takes all stress the same. And thinking back to our ancestors, we moved more on a daily basis. We were either hunter gatherers and we had to go out and hunt or go out and walk around and gather fruits and vegetables. And then even progressing into like back in the day, a lot of people, worked in farms or were building things, and that's just what they had to do. And now we have a very amazing society, but they have made things almost too easy for us. And even sitting and typing at your computer all day could be very stressful for you. And if you're like, all right, I need to go and run out all my anger, and you're going to go for like a sprint and do a lot of, amazing hit workouts that can be really beneficial for you. You're just sometimes compounding a little too much. And we've seen that with something considered female triad syndrome, which is long distance female runners, which is a big stress on your body, followed by chronic undereating, which upsets the gut as well. And they are at a risk for decreased bone density, hormonal issues, which causing increased irritability and all those other, depression, anxiety, things that are unfortunately very common nowadays. So trying to build back those pieces. Where can we put in a little bit more of those flow, yoga, Pilates, strength training, as well as fuel our body with important exercise? So I believe your study said that over a certain period of time, regular exercise can decrease the severity of irritable bowel syndrome, which is a very big term nowadays for a lot of the gut dysfunction in our society.
So IBS, a lot of people deal with IBS these days. The numbers are actually increasing, and we talk about that a lot with the processed foods. We've definitely covered that before in our podcast, and we will continue to cover it in upcoming episodes. But definitely a huge thing. And a study in 2017 with 11,000 people who were in the study. They all did questionnaires as far as their IBS. They all had IBS, right? So the people who exercised more, their symptoms were less. So again, if you have IBS, you're going to have symptoms. It could actually decrease with the increased exercise. So the best two exercises that they found for IBS were aerobic exercise and yoga. So aerobic exercise is the walking, jogging, kind of like a longer distance, not at a super high pace. So your heart rate is maybe, elevated to like 90, 100, it's not getting up into the 150s, 160s with the HIIT exercises. So anything aerobic, a great thing that they said in there was just going out for a speed walk, walking, fast is actually a great exercise for people who maybe can't go out and run because their knees are, sore, or, they're a little older, so they're not going out and doing the crazy exercises that others may be doing. So that's going to give you benefits. And then yoga, they found that was big. One, you're getting the blood flow, you're getting the exercise part of it, you're moving. But two, you're going in so many different positions where
that's huge.
You're able to kind of strengthen muscles that you wouldn't think to strengthen before in just normal exercise. Going to the gym, doing bicep curls and chest press might not be as beneficial as doing one yoga class for 45 minutes and getting into all those different positions, strengthening the core, strengthening the pelvic floor is really going to help with IBS.
And speaking from someone who does yoga, and I love when a yoga teacher kind of tells you a little bit of why you're doing the pose and the benefits that it has to the body, because there are so many benefits to some of these poses. Any twisting. So if you're twisting your legs or you're twisting your upper body, you're actually like massaging your intestinal tract by those movements, which therefore is like, how much better does your shoulder feel after it gets massaged? It feels great. You have more range of motion. You feel like you can take on the world sometimes. But it's really hard to massage our GI tract. So by doing some of these twisting poses or bringing your legs up to your stomach, you are getting that benefit. So that was really cool to hear that. I love when I hear stuff like that. So again, we might not necessarily think about the impact that our exercise has on our digestive tract and our risk and severity of something like irritable bowel syndrome.
So we covered mental health. It's mental health, but also just emotional health. So,
Huge.
feeling better, feeling happy, feeling productive. We covered the gut health. So the IBS, symptoms are gonna decrease with the aerobic yoga. So two amazing hidden, things that even as a physical therapist, I wasn't completely aware of going into my profession, that I've learned recently. So the third one we're going to talk about is neurocognitive disorders. So this one was also amazing because we both worked with people with dementia, Alzheimer's. You may know somebody that has this um, disease or disorder, and it's really tough because um, nobody, and even recently, nobody would think that exercise can have anything to do with dementia. Two completely different things, right, Courtney?
Right, exactly. We are seeing a rise in things like dementia, specifically Alzheimer's disease, Parkinson's, and those are all considered under a class of neurocognitive disorders. And unfortunately, like John said, in our profession, we are seeing so many of those individuals, and the research that's coming out on the impacts of exercise is incredible. A study conducted found that by completing regular exercise, your risk of developing dementia decreased by 23%. And specifically for Alzheimer's disease, it decreased by 45%.
Yeah, that's amazing.
That's amazing. Why are we not talking about this? Why are we not being educated day one about this?
And it was, we see the studies, we see the research done, but Courtney and I worked in a memory care unit for, a year and a half, and we saw this firsthand. The people who we
Yes.
treated who had Alzheimer's or dementia, who were on therapy, who were doing exercises for a long period of time, we saw that it would slow down the decline when they got off therapy. When they weren't doing the exercises, maybe they were, just kind of being a little bit lazy, laying around. Obviously, the memory's not there, so maybe forgetting to do any exercise. Um, we saw the decline, more rapidly.
Yeah.
So it's not only are we seeing it, in studies and in the research, but we got to see it firsthand, and it's amazing what exercise can do to slow down the progression of dementia, Parkinson's, Alzheimer's disease.
Right. Nowadays, we are just associating dementia and neurocognitive diseases with aging. People just say that's what happens as you get older. You get dementia. And that's not the case. And I think that it is so important to understand that and to bring awareness to that. And it's just not exercise alone. We will be talking about, I should say, the impact of our nutrition on our risk of
Yeah.
dementia and
Nutrition
Alzheimer's
might
disease.
be more important.
More important, right?
Yeah.
Exactly.
So
So
we will
we're
talk
not
about it.
saying that like going out and running is just gonna prevent you entirely from getting
You can
dementia.
eat McDonald's 3 times a day and go run and be fine, right?
No.
Oh.
But we are saying that there's studies out there, and some people might be saying why. And I kind of wanted to know this as well. And it has to do with the similar benefits for mental health. Is that when we're exercising, our muscles specifically are producing these myokines, which is a neurotransmitter, which is a, something that can cross the blood-brain barrier specifically and go into the brain. Having an increase in myokines is going to improve things like your memory, your focus, all these kind of like short-term benefits, but overall, long-term, having that impact, it is giving you that improvement in that cognitive function. Like John also noted, just increasing blood flow. Your brain needs blood.
Needs oxygen from the blood.
Yeah, it needs it. So by getting up, by moving, you're giving your brain that good, new, rich blood, therefore allowing it to live fully and do things the way it's supposed to.
Definitely. Definitely. So neurocognitively, gut health, mental health. on that track of the neurocognitive disorders, where we're talking about slowing down decline, our fourth hidden benefit, not speaking about the neurocognitive disorders, diseases, anything like that, aging in general.
Yeah.
So aging in general, as you get older, everybody just kind of thinks, it is what it is.
I'm supposed to get weaker. The amount of people that I evaluate in an inpatient rehab
I'm old.
setting.
I got back pain, knee pain. Yeah, I'm old.
I'm like, so are you having any pain today? They're like, not more than I normally have. I'm old. Same thing with like when I ask about their memory. I'm like, how's your memory? They're like, I mean, I'm old, so
yeah.
It's like that mentality of that the older you get, you're just gonna have these things that happen. But I've seen individuals that are not in rehab because they're not having these complications that are in their 80s, 90s.
Golfing, swimming.
Yes, living.
Biking, hiking, doing it all.
Right. And I think that if you were to look at some of these blue zones, which is a big term they use nowadays, where people live to be over 100. They have a lot of centenarians, is what they're called. They are doing even the most basic of walking.
A lot of walking.
Yes, walking and just stretching, sitting down on the ground. You don't understand how much that is a stretch to the body, but it's something that they're used to daily. I would never tell an 85-year-old person now to go sit down on the ground.
Yeah,
they're not going to be able to get back up. But if you're doing it your whole life and you're doing it regularly, then it's what your body knows. One of the blue
zones in, I believe it's Italy, the one in Italy.
Yeah.
The whole town is just a bunch of hills and stairs. So stairs is another big one. I mean, anywhere you go nowadays, everyone's going to use the elevator,
Right, yeah.
And especially if you only have to go up a few floors, I never, ever use the elevator. There's just no reason to. Just go up a couple floors. Even as a young person who feels like he's in shape, plays basketball, going up a few flights of stairs, I'm kind of like a little winded.
I feel,
I feel like a little winded. I'm like, geez. So stairs is a big one. And, you can continue to do stairs, walking, going, hiking, stuff like that. Obviously, you can, take little rest breaks, but just, continue to move. And that's going to definitely slow down the aging process. Wolff's Law, I want to talk about because I see a lot of people, especially recently in the outpatient clinic, who have osteoporosis. Osteoporosis is basically brittle bones. So as you get older, you don't use your bones as much. They're going to get weaker. So especially with older people, you might know somebody who has fallen and broken a hip, fallen and broken their pelvis or their back or something, in their body because their bones are a little bit weaker. And obviously nutrition has a lot to do with this, but Wolff's Law basically says that if you continue to put weight through those bones and continue to use those bones with walking, with stairs, with different weight bearing activities such as squatting and lunging and stuff where you're putting weight through, they're called closed chain exercises. They're going to continue to be strong and they're going to stay strong as you get older. And so you don't develop osteopenia, osteoporosis, and then unfortunately a fracture of the femur or something else in the body.
Right. And we've coined this term nowadays called inflammaging, which is essentially that as we age, we have more inflammation in our body. One way to decrease inflammation in our body is by exercising. Again, our body gets small inflammatory periods, like we said with the cortisol. You're actually causing that inflammation when you are exercising, but by rest, recovery, all those other amazing things that you do after that exercise, you are therefore decreasing your body's inflammatory response overall. So again, by completing any exercise, like Jon said, taking the stairs, I always like to say that if you are out there, gardening, or you are doing a hardcore clean of the house and you're in that flow state and you're moving, you are giving your body similar benefits. But how often are you doing a hardcore clean of your house? It's not like a daily thing. It's maybe not even a weekly thing, So how can you find those other ways to bring in a little bit of exercise? And again, if you are thinking of it as a punishment, I have to do exercise to lose weight, you know, then you're already bringing a negative connotation to it. As I said earlier, find something that you enjoy. Find something that matters to you and is purposeful in your life. Invite your family, invite your friends, invite your children or your parents to go out there and do a little bit of activity and see the benefits firsthand in that acute scenario, and then long term over months and years of continuous exercise. So I think that's so important that we bring more awareness to this, because obviously looking good is great. Feeling good, feeling good for long, purposeful life is even better. So taking this information today and really seeing where you can implement it. If you are someone that's maybe struggling with, you know, depression, anxiety, if you know your grandmother got dementia, it, you can help reduce your risk of severity by these things. You know, going back to that balance work, you can do. And if you don't know where to start, we always say reach out to us, guys. Go to your doctor. Tell them you feel a little unstable. See if you can get a referral for physical therapy. Get a little additional balance work. You know, there's so many things you can do, and you don't have to frame it in your brain as a punishment. That should be a reward, that you get to do exercise, that you get to have all these amazing benefits.
Yeah, so we challenge you to find some time in the day, because I understand we both work a lot. We know our peers, we know a lot of people, a lot of our friends work a lot. They have busy lives, whether it's with their family, taking care of kids. Everyone has busy things going on, but we challenge you to find some time. Maybe at lunch, you can, eat a little bit less, go on a nice walk after. Maybe you can go on a nice walk before and
Right.
then eat a little bit after. Kind of find that time throughout the day. Maybe you can get up just a little bit earlier, walk in the morning, do some stretching, go on
Yes.
YouTube, find a 10 to 15-minute yoga. We do that sometimes, where we just find it's again 10, 15 minutes, get some benefits of yoga, get some stretching, a little bit of blood flow. Honestly,
And
makes all the
it
difference.
compounds, right? Like we talk about the amazing benefits of yoga and walking, and then you're seeing not only the physical, mental, emotional, but again, the long-term effect. So, yes, it is. We understand that it's not always easy, but it is rewarding. And we challenge you to find that little extra time this week. If you do, and when you do, guys, post it in the comments. Tell us what you did. We want to celebrate.
Yeah.
You
Yeah,
know,
let
like
us know.
we are a community here. Let us know if there's something maybe that you have already been implementing.
Yeah, let us know your go-to exercise. Let us know. I mean, if you have a busy life, what's your, day-to-day routine where you do get some movement in, whether it's walking, stairs, whatever it may be, a full-on hit, Orange Theory, class, whatever the case may be. Let me know your kind of flow state when it comes to exercise. And if you aren't exercising, maybe this is the wake-up call where you're saying, oh,
Yes.
four more benefits than, just losing a little bit of weight, and feeling better, in 4 different ways. Like, definitely going to be beneficial at the end.
Exactly. So thank you guys so much for tuning in to this week's episode. We will be coming to you with weekly episodes, amazing information coming your way. So,
Yeah, we have a great nutrition episode coming up. So excited for, so stay tuned.
yes, have a great week, guys.
Peace.